Welcome, 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 welcome. So, you may have been experiencing some of those symptoms that you just saw, and you may have been experiencing them for weeks, months, and years. And up until this point, nobody knows what's really happening. But you know that something is happening in your body. Just like how when persons may have a toothache, they can't see that a person has a toothache, but they know that a toothache is there. Now, when it comes on to us and lupus, if it's not a rash that's visible to everyone, and then again, it depends on where the rash is. If it's not in our face or on our arms or on our feet where it's noticeable, then it goes unnoticed to everyone. But we know, you know what you're experiencing. And even though your regular doctor can't find a diagnosis or gives you a diagnosis, you know your body. You know it more than anyone else, even the doctors. And so you know that something is happening. My suggestion to you is this: be an advocate for yourself. Be an advocate for yourself. All right? So take up things in your hand. Switch your doctor. Change your doctor. All right? You don't have to change the doctor indefinitely, but you need a second opinion. And so go to someone else who knows. They might have better experience with these things. And so was the case for me. For years, I've been saying the same things, and even more things are added to what I'm experiencing to my regular doctor. And blood test after blood test has been done, and it comes back saying whatever he tested for, it's none of those things. But something is happening. All right. And so, with my husband's consent and permission, as he have been saying to me for months, you need a second opinion. Go to someone else. But I was unwilling until my symptoms starts getting worse. And so I decided to get a second opinion. And I went and I found a doctor, and just explaining my symptoms, she mentioned one thing that I thought that was it. Initially I thought I had chronic fatigue syndrome, because when I watched videos and I read symptoms of chronic fatigue syndrome, it lines up with most of what I was experiencing. And when I watched that video and I read that research, I bawled. I cried my eyes out, tears streaming down my face. But it wasn't chronic fatigue syndrome. All right. But the doctor, based on what I had explained to her, she made a referral, because she said to me, it is something that's autoimmune. And once it's autoimmune like that, based on your symptoms, you need to see a rheumatologist. And I'm like, who? Rheumatologist. Yes. Mm-hmm. And I'm like, I never did want her to know something. I don't know who I want a rheumatologist. So when I left, I Googled it. And so, yeah, that is how I know what's the purpose for rheumatologists and what they really do. So, yeah, she made a referral, and from the referral, we got 2 locations where we can check to see which rheumatologist we would want. When we called one location, they were full. All right. And I would not be able to get an appointment for months. And so because I was closer to another area for which they knew those rheumatologists as well, I was recommended to make contact with the one that's closest to me. And so my husband and I did. And we got the earliest appointment as 2 weeks time, I think, or 1.5 to 2 weeks time. Yes, I was scared and I was excited at the same time, but I was happy to know that somebody have some idea that I need to see a specialist. All right. Somebody that's well known with autoimmune diseases. And so we made the appointment, and all we had to do was to just wait to get there, wait for that day to come to get there. And so don't just sit with whatever it is that you're experiencing, because you will tell your doctor repeatedly, this is what I am facing. Some will even say that you have XY disease, or you're experiencing this, because the symptoms may be similar to other conditions, right? So be an advocate for yourself, because there are times when nobody will understand what you're going through, not even your very own doctors. And so you have to step up the game and be more concerned about your health rather than anyone else. As you continue to watch, you'll see how it unfolds within the few months that I have been diagnosed with lupus.
So she has found reason to diagnose you with SLE. All right. So she wants to, I don't know if she started it already.
No, because it says
right.
she wanted the examination to be done before.
Right, because some other doctors actually started before. Okay. But I prefer if we do the tests first to see if there's anything. What's happening is that drug very rarely, not commonly at all, very rarely, I think it's 1 in 100,000 people who are on it who will develop a problem, right? Or it's 1 in 100,000 can develop changes to the retina in this area. Now, this part of the retina is the part of the retina that's responsible for your sharpest vision. And what can happen in, as I said, 1 in 100,000 people is that you can get abnormal pigment being deposited in that area that can affect your color vision and the sharpness of your vision. All right? So what we do is that before the patient starts it, ideally, we want to make sure that this area is healthy.
Okay.
Right? If the area is not healthy, it's not recommended that you start it. Okay? Right. And then once you have started it, yearly we monitor by repeating the tests. Okay?
Yes.
Good. Now we will look at the retina to make sure that it doesn't show any gross signs of abnormality in that area. Okay. Right? And we'll also check the pressure in the eye. Right? Apart from that, there are 2 tests that need to be done. One is a visual field test, which checks the sensitivity and function of that part of the retina. So basically, we show you things that correspond to that part of the retina on a machine, and you are to press a button once you're seeing the items. Okay. And it maps out that area to make sure that that area is functioning properly. We check the function in that way, but we also check the structure on a microscopic level by scanning that area to make sure that the cells in that area are normal and that they have the normal number of cells in that area. Okay. All right? Now, sometimes if we're having trouble seeing the center of the retina, we will have to put in drops that kind of dilate the pupil, which can blur your vision for about 2 hours. So I'm trying not to have to do that. But you have very light irises, so we should have a very easy view. Here you do have a bit of dry eye though. I am showing you a line of light. Now, is the line in the middle of the line, is it straight or is it bent or broken?
I'm seeing it straight.
Very good. The macula looks normal on that side. So it looks good on the gross level. Let us check the pressure in the eye, but you do have a bit of dry eye, which is not uncommon in patients who have lupus. Okay? I'm going to put a drop in the eye. This is not going to blur your vision. It's just going to numb the eye for about 20 minutes, just so that we can check the pressure. Good. Open the eyes wide, 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 both sides. Good. Excellent. Pressures are normal. So on the gross clinical level, this is absolutely fine. And in days gone by, that would be enough to say that you could use the Plaquenil, right? The HDQ. However, these days, we have to, it's gold standard for you to look to make sure that there is no sign of microscopic disease, because that means you could stop anything from happening from before.
Okay.
Right? But put you on some drops for the dry eyes. One of the eyes are one of the first places that the immune system tends to bother.
Okay.
The test is a visual field and an OCT. But make sure you use this, which is for the dry eyes.
Yes.
can get the cashier from it.
Okay.
Thank you.
You're welcome. Likewise.
The doctor is suggesting that he recommends we don't start the HCQ, which is ideal in your situation, the recommended, when we can't use it. If he's saying that, not that anything is wrong with the particle, but it does have some reduced. And this is likely due to our myopia as a normal variant, but it may significantly increase your risk of maculopathy. Never do it. Don't in most cases. But once the doctor thinks you're at risk of that part of the area being damaged from your overall condition, we try not to interfere with the eye because then the sight is so vital. So we try not to interfere. He's saying it will significantly increase your risk. What the medication can give is a problem with the macula, which is a major point in your eyes that let us see. So whenever you have any other condition that can make that area worse, we try to avoid the medication. Right? It may never affect it. You may never do it. It don't in most cases. But once the doctor thinks you're at risk of that part of the area being damaged from your overall condition, we try not to interfere with the eye because then the sight is so vital. So we try not to interfere.
So
In absence of that medication, now we go into the medication that can possibly affect fetus. Can make babies extremely deformed, can cause miscarriages.
Hope you're enjoying the video so far, and by now you would have known that this video is all about an autoimmune disease, lupus. All right, so in this segment I am going to talk about treatment that I have received and possible treatment that you can also receive once you have been diagnosed with lupus. HCQ or Plaquenil is totally out of the picture for me based on my eye exam and the recommendation of my ophthalmologist. So the next two options were methotrexate and azathioprine. Now the decision that I had made was to go with methotrexate. So that was my first lupus medication in terms of main medication. All right. But to be honest, I think the first week of starting it, my body felt a little bit better. But it is said that, and I was also told by my rheumatologist, that it takes at least 6 weeks to kick in, and it can go up to 3 months, and it can go up to 6 months before a medication actually starts working in the body. So just 1 week and I feel like something a go on. It can be as a result, or it's just that I am happy that I have started a treatment method. But I definitely could get out of bed. I had no issues getting out of bed for that time period. So to me, it was doing something for me, even though it wasn't fully working as yet. And I was also on other medication, such as prednisone. Prednisone. Oh my gosh, man. That's a different conversation. All right. And so methotrexate, in the very first week, one side effect that I also saw in several readings and online is what you call bleeding of the gums, bleeding of the skin. Hello. But for me, it was neither of those bleeding, but yes, methotrexate caused me to bleed. I bled for over 4 weeks. And when I mean I bled for over 4 weeks, I am talking about vaginal bleeding. So that was the biggest side effect for me. I read 2 articles while doing my research, because I was like, I am not seeing this anywhere. It's like nobody else have experienced vaginal bleeding except me. So I was going, and I came across 2 articles. I am the 1% of the many females who might experience this. I don't know if other females have experienced it while being on methotrexate for lupus, and I'm stressing lupus because methotrexate have been used and can be used for different treatments. All right, so it has been a rough patch for me when it comes on to methotrexate. And some persons would say, boy, Dana, you're bravey. Yes, I wanted to make sure that it was what was causing the issue. And so I waited 4 whole weeks. And I waited 4 whole weeks because I knew the time was coming up for me to also do my blood work. All right. And I wanted to make sure that methotrexate is what was causing the vaginal bleeding. And so I stuck it out. It was very challenging for me. I had issues going places. I could not take any chance without being prepared, because I don't want to be embarrassed. I don't want bleeding to start and embarrass me. And then some people, then she never did know say her period I go come. It's not period, because 1, I have to be on a contraceptive method in order to take methotrexate. So for me, there's no regular period. because methotrexate can cause abnormalities or deformities in babies if pregnancy does occur. And so they want to ensure that if abnormalities or deformities happen, it's not a result of methotrexate. So yes, so most of the time I stayed home, and it was in a time period where it wasn't work, so I was mostly home. Even if I have somewhere that somebody may have invited me to, I opt out of it because I felt ashamed to know that every day, every single day after that first week, for the first week I think it was 3 days, but then after that every single day. So for that 6 weeks period it was hard, very hard. And after 4 weeks I decided to see my doctor, and my doctor said I should stop taking methotrexate altogether until I have done the blood work, because she wants to ensure that if any damage is being done to my kidney, it is not continuous. And so I stopped taking methotrexate, and the blood work came back with my liver and my kidney being quite okay. So I know that it did not damage any of those organs. All right, but my rheumatologist was letting me know that it could be a case whereas something is happening with my small intestine, and that may be the reason for the bleeding. But at first I thought that it was as a result of having low platelets, but the blood work came back and none of those things were there, because I was so happy that I was now being treated for something that I suffered with for so long, 5 years actually, without knowing what was happening to me. And when I was finally told, I felt so relieved. I know that I'm on a treatment, to know that this treatment is doing me wrong. I felt so bad, because I know that once these things are happening, but definitely I forgot to stop taking methotrexate. And that is exactly what happened when I went to my next visit. My rheumatologist let me know that you can't continue with this. And I already knew also that I would not continue with methotrexate, because we can't get up a bleed every day of my life when there are other medications, ATQ, Plaquenil, that out of the picture for me. So I never start that, none at all, because of eye problems. And as you know, see, this is a test class. All right, I tested my eyes probably a year prior, and I have myopia. And then, as you also saw by my ophthalmologist, I have dry eyes, and he said the eye is one of the main thing that lupus, or one of the first thing that is affected by lupus. So me have to take eye drops. Yeah, and so I am now on another treatment for lupus, which is azathioprine. No, I take that every single day, along with folic acid. I used to take the methotrexate with folic acid as well. Right, but the folic acid here, I only take it for 5 days, while the methotrexate runs for every day, similar to the azathioprine right now. And I can't say I really experience any different issues or side effect outside of what was already happening from taking prednisone. Yeah, so those regular things. Yeah. And during the course of methotrexate also, I ended up having 2 rashes. One came out just with a little dot, a little red dot. And when I noticed it, I was like, I never really see this before. So when this come up on my skin, like hours before, and then like couple hours later, I'm like, me see it and I'm like, oh, where you come from all of a sudden? So, and then I decided, a matter of fact, me never remember nothing about it for 2 days. And then it's like I was in front of the mirror and I said, let me examine my hand. I was there examining my hand and I saw the big old red spot. And I'm like, wait, I the same little teeny tiny spot turn into a big red spot, skin rash. And then probably 2 weeks later, another set came up, and it came up with bumps, and then it just turned into this rash. When you look, the spot white like when somebody get burned and the whole of the skin come off and you just see the flesh. That is how the spots were, while some of them around it's red. And when my rheumatologist prescribed a cream for me for rashes, I was like, do I really need this? Because I thought that once me never did have no rash in the first place, me might not get none. But knowledge is power. And so that was the very first time, which is like what, probably 3.5 months later, the first time I'm using that cream that she gave me. Yeah. Because I did not use the cream for the first rash that came up, because I wanted to see how long it's going to take to disappear on its own. So the point when I saw the rash to the little spot to when it turns out into a rash, that was 2 days, and then 2 days later it disappeared. Oh boy. But for now, I am not having any issues with the azathioprine. No issues. So I have another doctor's appointment coming up in a few weeks. Yeah. So I'm looking forward to that. So yeah, that has been my journey with the treatment so far. And with methotrexate, when I just started, the very first day I started take it, I felt so sick. I have this terrible chest pain. It was horrible. And then for me, I started off with 6 tablets. So I I took 3 in the morning and 3 in the evening. That's how my doctor recommended me to take it. And so that is what I have been doing. But I have seen online where persons, they started taking it everything in the night, so that's everything settles in the body. But my rheumatologist said that if there is any issue that is starting to happen, she wants me to know about it from in the day. Because most likely when your body is at rest, when it is sleeping, some of those symptoms may go unnoticed while you're asleep. So she recommends me to start it from the morning and observe any changes in my body or any reactions to the treatment. Yeah. But for azathioprine now, it's once daily, and it's 2 tablets once daily. And I often like to take my medications in the morning. It's just a different feeling knowing that I started my day with my medications. Yes, that's a plus for me. When I do that, I feel like I have accomplished something. When I wait until the evening, because I've tried different methods, so I know which one works best for me. And morning, favorite time to use it, especially if the medications are once daily. Yeah, that's how I choose to take them in the morning. So if you are scared of lupus treatment and your rheumatologist is telling you about all of these, don't be scared. Don't worry. Why? Because everybody's body reacts differently to each treatment. So what I went through, that might not be what you will go through. So don't panic. Don't fret. Just trust the process and let the rheumatologist do what they have to do, and let God do what must be done, and you do what you have to do. Yes, because guess what? It's not us not taking the medication that's the it's not us taking the medication that's the problem, you know. It's when we don't take them that's the problem. And we need to become better, you know, and to live a meaningful life. And for me, my life has been affected in so many ways, drastically, because things what me normally do on a regular, me can't do them on a regular because my body will not allow me to. So, you know, there are many days when I beg to be normal, because right now I'm not normal. With whatever me I got through in my body, no way. I'm not normal because I can't do the regular things as other people can every day. I may get through one day and I'm fine. Just like I can remember being at work one day, oh my, and I felt like I was walking on cloud 9. Honestly. But just have boom the whole day. What me say? But just have go through the day like no issues. I'ma feel good, you know. Feel good in myself. I'm like, yeah, girl, you're good today, man. You're good today. And I felt myself smiling a lot through that day. And I was like, thank you, Jesus. Thank you. Next day, oh, me pop down. What me say me do? Me pop down, can't budge. Me just a crawl like a snail, so. Oh gosh, man. And another thing too, when you have a good day, enjoy that day, because the next day no must be the same. And I have come to realize that you can't do everything for everybody, especially in this condition. So take care of you so that you can be able to take care of somebody else. All right? Yeah. So continue to watch the video. And if you have not yet subscribed, please subscribe to the channel. All right? This is not just my health, but our health. And that's the name of the channel, Our Health JA. All right, so there's another section coming up shortly, which is the financial aspects of my journey so far. So stick around for that. This should be interesting. You should also know. All right, so in this section, let's talk all things financial. Money, 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 money. So the first time I visited the rheumatologist, the initial cost was $10,000, and that's 10,000 Jamaican dollars. All right. Anytime after that, so your second, third, fourth, fifth, whatever visit it may be, it's going to be less. All right. And then as time progresses and inflation arises and increases, you know that money is going to go up. All right. So, yes. So, first visit out of the way, $10,000. Now, after having that conversation or that consultation with my rheumatologist, all right, you know, say, I got prescription and I have to fill those prescription that take money too. All right. And blood work to be done. And then those things have to be repeated on a monthly basis, or let's say 6 to 8 weeks time. All right. And so money have to spend. And because money have to spend, you have to know budget. All right. If you weren't budgeting before, you know have to budget. Because for me, I have to now put this in my list of expenses. All right. And possible to take out something out of it where you normally have in there, where you not have to have in there. All right. So far, and not to mention that each time I'm heading off to Mandeville, I have to ensure that my tank is full, because guess what? Anything can happen on the way. And even if I want to take a chance and go with 3/4 tank or half tank, my husband would not allow it, because he says, you never know what can happen. And that's true. All right. So once the finance is there, you go right ahead, fill up your tank. If you drive personally, if you have to take public transportation, then you still have to put that fare aside. So, yes, having an autoimmune disease, any autoimmune disease, but specifically, today's video's focus is on lupus. All right. So, yes, you have to budget. And even though I have insurance, and insurance will take care of some of the expenses, there are the remaining expenses that I have to cater for. So I still have to have some cash in order for me to be able to do that. And I am so thankful, yes, so thankful for insurance, because if I didn't have it, it would be like, because I can tell you, after my first visit with the rheumatologist, the first blood test that I did, it cost initially $50-something thousand. But when the ANA is added to it, it's over $60,000. And you know that insurance only covers a portion. And so I had to take out of my pocket. I have to dip into my handbag, get into my purse, go into my account, yeah. And I have to take out the extras where the insurance can pay for. But what if you don't have the extra to cover? Me I telling you for now, nobody feel shame. Put on your pride. If you know you have one auntie way and the auntie move good, ask auntie. Auntie, you know, say, this month me in a one little situation I'm have my blood work for go do because my rheumatologist visit is X time and I'm not seeing the cash as yet, or I don't have the full amount, and I'm asking you for your assistance. Sometimes, you know, we make pride take way over when we need for ask for little help. Yes. And so it is what it is, because I know that there are some persons, they are out of a job. Some persons, due to medical conditions, they're unable to work. And so sometimes it can be real hard. All right. I have my husband to chip in, and I have other family members who chip in as well. So I am thankful for them and family, and they know who they are. So I thank God for them too, because it is Him who has put it in their mind to have that goodwill to help me. And so I'm thankful. And so, yeah, because when I sum up everything over the last 3.5 to 4 months, including this current blood work that I did, which is not a part of this video, I have spent over 210,000 Jamaican dollars so far. So can you imagine? And my lupus, it's not severe. I'm not one of those severe cases where my kidney is affected. Me not reach there, so I may hope and pray to God I don't reach there. You know, I want these medication to work and work in me, that I get back to my normal life, at least 60%. Yeah, I'm hopeful and praying. And I know others are praying for me as well. And I do appreciate the prayers. All right. So just know that once you are diagnosed, expect to spend more financially. All right. So this means prioritizing and making your health one of those priorities. So then, once this video has been educational, informative, or inspiring, remember to like, comment, share, and subscribe to the channel. All right? And turn on those post notification bells so you won't miss a new upload when a new video is out. Now, remember that we make it through each day by God's grace and mercy. So, Godspeed.